We've got quite a big panel, but that means we get a lot of perspective here. Marleen, I'm going to start with you because I know you need to leave early. Later this year, there is a plan to launch a global strategy for women, children's, and adolescents' health. You were deeply involved in this, if I remember correctly. What does it aim to achieve?
Well, Chrissy, thanks for the question. And as you said, the previous strategy was for every woman, every child, because in 2010, the Secretary General said, well, MDG 4 and 5 are lagging behind, so we need an extra effort, we need a global strategy. And you have shown already the figures and the results. I'm not going to repeat this. Now for the future, it was clear that the young generation is actually not really covered in the current Every Woman, Every Child strategy. There are, of course, a lot of data on adolescents, on young girls, young boys, but more needs to be done for this huge dividend of young people. That's why, at the request of many, in the UN, outside stakeholders, it was decided to give more focus on the young people and adolescents because they are the future. So now, as far as the process is concerned, the difference with the previous strategy, I think, and the previous MDGs was that it was more conceived by a smaller group of UN and a smaller group of people, and now it's really a very broad consultation. So what does it mean? That the new global strategy, it's called Every Woman, Every Child, Every Adolescent, in every setting, taking into account humanitarian settings, looking at inequities, inequalities. And that the process is much more consultative. So it's countries, governments, but also the civil society, the young people themselves, they can give input. And we have developed this consultative process. There has been a consultation in New Delhi, last month in Joburg, and there is an open process on the internet. So people who want to contribute, we have kind of background papers on the woman, the child, the adolescent, on health systems, innovations, on social determinants, and many more. And everyone can contribute to that process. It's still open till the 5th of June, so please go to the website, read it, and give us your input. And then the last thing I want to say is that in the global strategy, Every Woman, Every Child, one of the priorities was survive, reducing maternal mortality, reducing child mortality, which is great, and we still have a large unfinished agenda that we don't stop the MDGs, of course, but now there is more on survive and thrive. Adolescents, it's also about health and well-being, and how can we do it differently? So how can we transform and involve young people more in this process about adolescence?
You know, you touched on something just a moment ago. I wanted to ask a quick follow-up question before I let you slip out. We often see the women and children together, and adolescents a little separate. Now they're all together. What's the benefit of that?
Well, I think we have to look at women not only as mothers, because in the previous efforts it was like a woman as a pregnant woman in her task of bearing children. Right now there is much more emphasis into women's health, not only the child, the pregnant woman, but the woman, the NCDs, the cancer, all the women's issues are there, violence against women, so many more women-related issues. There is, of course, the pregnant woman and the child that goes together. And just to say, if we invest more on delivery, childbirth, we really can have a triple return on investment. We can save women's lives, neonates, and prevent stillbirths. But then adolescents are a separate group. They are young girls, they will be mothers, but they will be women in their own right. And every woman, every child, every adolescent is also looking at older women, because life doesn't stop at 49. Most of our statistics are from 15 to 49, so women of reproductive age. But this new framework is also looking at women and their needs and their health, not only mortality, but also their health and well-being beyond 49.
Thank goodness life doesn't stop at 49.
We all agree on that, I think. Couldn't agree more, Christy.
Before I let you slip away, if people want to participate in the consultation before June 5th, where do they go?
They go to the website of PNMCH, the Partnership for Maternal and Newborn Child Health, and there they can find all the documents. It's also at the UN Secretary General's website, so there are several entry points where you can find every woman, every child. If you look for that, you will find it.
Terrific. Thank you for coming by, and you can slip out as you need
Pleasure.
to. Joy, let me come to you next. Your organization recently released the 16th annual State of the World's Mothers Report. What did this report tell us?
Well, as a matter of fact, I brought a copy of the report with me so people can see the cover. This is a report that Save the Children issues every year, which has an index for the health of women and children and ranks countries as the best places to be a mother and the most difficult places to be a mother. So as expected this year, the Scandinavian countries came out on top, so it was Sweden, Norway, Finland, those countries were at the top, and also, not surprisingly, the countries that have been suffering a lot of conflict in Africa are at the bottom, with Somalia actually being at the very bottom, but other countries like the Democratic Republic of Congo and Niger, those countries are very much at the bottom. In addition to that, though, the report reviews some of the good news that we've heard about earlier in terms of reductions in maternal and neonatal and child health. And it's entitled The Urban Disadvantage. And the reason for that is because I think for the first time it really calls attention to the inequities in healthcare that exist in urban settings between the very rich and the very poor in urban settings. So it goes through an analysis of about 40 countries by wealth quintile and shows that the disparities among the health status of women and children in major cities in the world are actually widening, and about half the countries have very severe gaps between the rich and the poor for maternal and
Before
child
I
health.
get you to elaborate on that,
Yeah.
I want to tell my viewers here that if they want to ask questions of this panel, hashtag WHA68 and hashtag SocialGood. Joy, let me come back to you for one question on that. Why is the world struggling so much to close that gap?
Well, I think in the past we have been operating off the assumption that most of the neediest people in the world live in rural areas. I've been working in public health for the last 30 years, and we've always talked about community health workers and community structures and organized our programs assuming rural residents. And I think that now more than half of the world's population lives in urban areas, and we've really got to have a paradigm shift in the way we think about urban populations and be much more deliberate about targeting the urban poor, those that are living in slums, and think about providing not just narrow health services, but a broad array of services, social services that will help uplift them all together, entire families.
All right, State of the World's Mothers Report from Save the Children. Thank you, Joy. David, over to you here for a moment. Tell me a little bit about your grassroots work in Tanzania to improve maternal health.
Okay, thank you very much. We've been doing a lot of work at the grassroots level, especially with the citizen. For example, in Rukwa, Tanzania, where we did an assessment looking at the availability of CMOC services, because this is the promise which made it by the government in 2008. By 2015, at least half of the health centers providing CMOC services. These are life-saving care services, comprehensive. So we did an assessment looking at how the government have made the progress toward that commitment. And we came to realize that actually none of the health centers in one region providing that kind of services. So we actually involved citizens in that process. And that was 2013, 2 years ago. Using the existing resources, using existing structure, we were able to make a turnaround. By this year, actually even half of the health centers providing CMOC. And the secret is one. We actually made the citizen being the center of everything, because at the beginning or before, citizens were not involved in setting their priorities. citizens were not involved in making the budget for themselves. So it was basically planning based not on evidence. So you're able to demonstrate that, okay, these are the needs of the citizen, and you guys, you need to sit together, because the practice most of the time when we hear about citizen and the government, it's a clash. But you're able to harmonize that situation, making sure that, okay, you guys, you need to work together, and citizen, these are the end users. They've been a buzzword this week that there's nothing for us. Nothing about us without us. Mm-hmm. So it was basically try to demonstrate that, okay, if you're planning for citizens, let them plan, let them set priorities based on what they want, and you're able to achieve sustainable, very substantial results.
Very much what Marleen was speaking to as well, wasn't it? Let me jump to Helga, and then you guys have questions coming in from Twitter, okay? Helga, let me come to you for just a second. Where have we made encouraging progress on improving children and maternal health? What do you see?
We've made progress in many countries. I mean, we've reduced child mortality by 45% and also maternal mortality by 45%, and the other one was 49%. So we have really done a lot of differences, but we have a lot left. There is an unfinished agenda. We need to do more. We need to concentrate also on the equity problem. We have to reach the unreachable. We have to focus more on that. So, but there is issues of better health, better education. A lot of success has been done, and a lot of reasons for that, Christy, have been the mobilization between partners. The UN Secretary General has been absolutely great in spearheading the global strategy. The multilateral organizations, WHO, UNFPA, UNICEF, and they're really coming together in having increased the mobilization of that has been needed to make success.
Elaborate just for a second for me. How do we address the equity issue?
Well, we have to reach the unreachable. It's both, as in Save Children were saying, that it's also an urban poor, but also in the rural areas. We have to pay better attention to where we have the pockets of unfinished agenda lie, and pay better attention to that. And I think, given that we've done so much progress, that there is time actually to do that now.
Terrific. First question coming in from our viewers. What is the biggest issue facing women and children's health? Joy, you want to take that one?
Well, I would say that it really is, going forward, the unfinished agenda. It's the fact that you've heard the figures, we have encouraging progress, but we still have a lot of work to do. And I think that what we have going forward to finish the agenda on both the health of mothers and children will be much more difficult, because we have to deal with more than just disease issues. We have to look to social factors like social exclusion that prevent women and their babies from coming to clinics or being treated properly. So it is going to be a much more difficult, maybe more costly, and more targeted effort to make progress.
Okay, everybody behind the camera is giving me a rap sign, even though I still want to talk to David about how we track progress and things like this, but I can't, or they're just going to start throwing things at me. So I will say goodbye to all of you. Really, we could continue this conversation easily for another 30 minutes, and I won't ask you the white card, which was what keeps you up at night. But really, lots of interest in this topic from our viewers, so thank you all for what you do.